Hi everyone, so this is another video in our IPV training sessions. And so in this video we want to speak about red flags and also about an approach to risk assessment. I think with anyone who is dealing with someone who's a victim or survivor of IPV, the question is, when is the patient's life most at risk? And it's important for us to understand that and also to educate our patients on when they are most at risk. So, Dr. Gordon, is it possible for us to even make that assessment?
Yes, it most certainly is, and I like that you've introduced the idea that what we are considering is whether somebody's life is at risk, because at the end of the day, our intervention with IPV or lack of intervention could be the difference between somebody who's alive and somebody who's dead, and that is ultimately the very bottom line. So we are trying to prevent people being in body bags, either a woman being murdered by her partner or a woman murdering her partner in self-defense. So there's it can go both ways. So how do you know when the situation is particularly risky in terms of risk to life? So not every abusive situation is as deadly or dangerous as the other. There's a very broad spectrum of types of abuse. How do you know when things are really bad? So firstly, if that patient fears for her life, do not ignore that, because things have happened to her in the course of this violence that have made her actually fear for her life or her safety, or if she fears for her children's life or safety. Those are two very powerful fears to have of your partner, and highly significant. Then certain behaviors are in the partner. So if they've ever attempted to strangulate the woman, that is a very high predictor of homicide. If they abuse substances, so you can imagine that the substances remove the very last inhibitions that this person may have to committing violent acts. Also, we know that perpetrators who abuse the children as well. So if it's the mother and the child who are being abused, that is a higher risk situation. And then if there is a weapon involved, and we're not only talking about a gun, for example, we're talking about any object that is used to cause physical harm to someone. And then another significant factor is if the abuse has been escalating over time. So it's becoming more frequent, it's becoming more violent, or it never used to be physical and now it has become physical. That is another predictor of very high risk. And I also very much like what you said about you needing to inform the patient of their risk, because that is what you have to do. If they are in a very high risk situation, you need to communicate that to them, because they need to make an informed decision as to what their next best step is.
Yeah, and I think in a previous video we mentioned pregnancy. Is that also a risk factor, or is that a separate?
So yeah, certainly. I mean, we're looking at things that predict homicides. So pregnancy in itself predicts the incidence of physical violence, but not necessarily an increase in homicide. So pregnant women are more at risk of experiencing violence for the first time, but not necessarily homicide. So what we're talking about is very much about what predicts a homicide. And something else which can sometimes be of significance is if the partner is some kind of law enforcement or army or trained in that kind of thing, because that often goes together with access to a weapon. So that's something that's significant.
Yeah. And I think with all these risk factors or these red flags, I think what's important is that we actually need to ask these questions of our patients and say, does your partner have access to a weapon? Has your partner ever strangulated you? Is there some sort of segue we can use to asking these questions? I think they're quite direct questions, and I think when you speak about how we approach the patient, we start broad and we slowly get to the details. Is there a way to sort of segue into these really, really possibly triggering and scary questions?
Yeah. So, I mean, the risk assessment for me would be the last stop in the pathway of this conversation. You know, when you're starting broad and opening the door to asking the question and then asking about what types of abuse this person may be experiencing, even if you forget to ask them what types of abuse they're experiencing, if you can just remember a few of the risk assessment ones, that will stand you in good stead. But you know, you've always got to the whole of medicine. Patients will answer you if they understand why you are asking the question. Okay, so when it comes to sensitive questions, you do have to give them warning and say, look, the next few questions I'm going to ask you are quite hectic, but I need to ask you because I need to know how much danger you're in. If you couch it in that way, you know, in my experience, women will talk. They will open up everything to you. They will give you all the dirty laundry if you just give them a compassionate platform on which to do that. They are not expecting to be asked the question that you've asked. They're not expecting to be asked about abuse, but they're going to be so relieved that somebody actually has asked. So if you do it in a very empathic and compassionate way and you explain, they will tell you.
Yeah. And then once you've got that information, do you report back to them and say, because you said this and this and this, I'm very worried that your life is in danger? Do you actually say those explicit words to the patient?
The explicit words. So you mirror everything back to them and you say, these are very high risk factors for a homicide, and you explain what you mean by homicide. You also, if you do uncover child abuse, you are legally bound to report that to social services, and that is something that you would have to explain to her as well, and that can sometimes be a motivating factor for her to leave the relationship. This information, the risk assessment, is to tell her what her risk of homicide is. It's not to try and manipulate her to leave, but it's to tell her what the risk of staying in the relationship is. She already knows what the risk of leaving the relationship is. And now she has to make that awful decision of which is the lesser risk. And that's got to be an informed decision that she makes with the information that you're giving her.
Yeah, sure. And then, like you mentioned, the risk of leaving. So is it, like everyone always says, that the patient is most at risk when they plan to leave the partner, and is that's I think also something to build into the risk assessment, I'm assuming.
Yeah, so I think, so Danny and I touched on this in the other video a little bit, but yeah, your patient needs to be told that leaving is also a very high risk, but often they know that, they sense that is why they haven't left yet. Because often, so let's put it this way, most people don't want to leave the relationship, they want the violence to stop. But when they start feeling like their life is at risk or their children's life is at risk, they do start thinking more about leaving, but they know the risks. So you do have to have a very, very open and frank conversation with this person. Because you need to re-empower them with the correct information to make the best decision. And if the best decision for them is to not leave, we cannot judge that, and we cannot counter that, because they know the risk of leaving and you've explained clearly the risks of staying. And if they still choose to make that, then that is their decision ultimately.
Yeah, sure. Thank you, Dr. Gordon. So we've touched on certain risks and or certain red flags that indicate a high likelihood of homicide occurring in the relationship, and an approach to how to ask these questions and when to ask these questions in the conversation with your patient. Thank you, Dr. Gordon.
Thank you, Peace.